For a long time, clinicians were puzzled by the presentation of heart disease in women. Women would come into the emergency room complaining of chest pain, but their symptoms would not align with those commonly seen in male patients. Instead of experiencing chest pain during exercise, these women reported chest pain primarily at moments of rest. And when the doctor scheduled a test to look at the heart's blood vessels, everything appeared normal. This occurred on such a frequent basis that clinicians started referring to the condition as cardiac syndrome X. In reality, the presentation of heart disease in women is typical. It just refers to a different sort of heart disease. Welcome to the Women's Health series, a School of Women's Health production. On this channel, we dive into the research on women's health, aiming to decrease the gender gap in research and medicine and empower women. This is episode 1 in the Women's Health series, where we explore how a wide range of disorders presents differently in women. There are 3 important ways in which the female heart differs. The first important difference is estrogen, a hormone naturally produced in a woman's body that's important in regulating her menstrual cycle. Estrogen offers protection against heart disease. It helps control cholesterol levels and widens your blood vessels, which in turn lowers your blood pressure. Thanks to estrogen, the risk of heart disease is lower in premenopausal women than in men. But a big change happens during and after menopause, when estrogen levels drop and women lose this protective factor. The tables turn and women are now at a higher risk of heart disease than men. Menopause is a critical time point where symptoms can drastically worsen. The second important difference is the way in which cholesterol builds up inside the blood vessel walls around your heart. Men typically develop this cholesterol buildup in the largest arteries that supply blood to the heart, known as the coronary arteries. In women, on the other hand, this is more widespread and less obstructive. Due to the protective effects of estrogen, women are more likely to develop this cholesterol buildup in the heart's smallest blood vessels. The third important difference is risk factors. Although women and men share most classic risk factors, such as high blood pressure, high cholesterol levels, smoking, diabetes, and obesity, these risk factors only partly explain the occurrence of heart disease in women. There are gender-specific risk factors at play too. Being a woman means you can develop conditions that men can't. Conditions like endometriosis, PCOS, and pregnancy-related high blood pressure have all been shown to increase the chances of suffering a heart attack. In fact, research has shown that women suffering from endometriosis are 3 times more likely to have a heart attack. The connection? The chronic inflammation that accompanies endometriosis may also inflame the blood vessels. Gender-specific lifelong risk factors include migraines during adolescence, PCOS, endometriosis, early menopause, preeclampsia or pregnancy-related high blood pressure, gestational diabetes, and repeated miscarriages during the reproductive phase of life. And in postmenopause, risk factors include rheumatic diseases and endocrine disorders. Emotional stress deserves a special mention. While in men vigorous exercise is frequently associated with heart attacks, severe emotional stress is more often a provoking trigger in females. Studies show that women's brains are more sensitive to stress than male brains. When women experience chronic stress, it can result in inflammation of their blood vessels, which increases the risk of heart disease. Because women develop cholesterol buildup in the smallest rather than the largest blood vessels of their heart first, the symptoms they present with look different. Heart attacks can be harder to spot for women. You can arm yourself with knowledge. These are the 4 most common signs of a heart attack in women. The first sign is chest pain, chest squeezing, or chest discomfort. This chest pain can worsen with physical activity and emotional stress. But whereas men mainly experience chest pain during exercise, it's more common in women for chest pain to persist for several minutes to hours after exercise. Women are also more likely to experience chest pain when resting or when asleep, especially between night and early morning. Secondly, whereas men typically feel a radiating pain in their left arm when having a heart attack, women tend to feel pain in various locations, such as the left arm, the jaw, neck, back, or abdomen. The third sign is shortness of breath, and the fourth sign is a loss of energy and extreme tiredness. Research suggests that in women, sudden and unusual tiredness, accompanied by new problems with sleep, might be early warning signs of an upcoming heart attack. Women with severe heart disease typically experience a loss of energy and extreme tiredness that can fluctuate over time, along with a variation in exercise tolerance, with a reduced tolerance in the morning. Thank you very much for watching this video. I hope you found it informative. If you're left with any questions, please feel free to leave them in the comment section below and I will try to get back to them. I've also linked a couple of relevant research articles in the description box. Stay tuned for next week's video where we explore the evolution behind menstruation.